Module 3, History of U.S. Healthcare. The idea of a person being a medical professional is actually a recent modern development. Prior to the 1900s, if you were sick, if you're ill, you were pretty much on your own. You were taken care of by family using various alcohol-based tinctures, concoctions of some sorts. There really wasn't anything organized. The idea of evidence-based medicine was decades away. So people pretty much were taking their health on their own. Uh, in regards to any kind of profession, the only thing at the time was this idea of the barber surgeon. This is where you'd go for a shave, a haircut, and to be bled or some other effect of what people think was a form of health care. For the most part, early U.S. health care really was non-existent. That's not to say that nothing was happening. In the late 1700s, there were two places where people who wanting to uh, be known as a medical doctor were able to go and seek training. One in New York in King's College, another in University of Pennsylvania, the College of Philadelphia. These were the first medical schools in the country. But there really wasn't a, a large draw. For the most part, there really wasn't seen as being any money in it for a lot of people. It was a calling, much like being a religious leader. People really had an interest or need to be going into the profession. At the time, there were also really no hospitals, so people were being treated at their homes. Doctors were making house calls because there really wasn't anywhere else for people to see a doctor. And so, in terms of payment, again, people were being paid. You see a lot of people receiving or trading care for in exchange for other goods and services. The kinds of hospitals that were available at that time really weren't places where people could go to seek seek care. They were primarily were seen as places where people went to die, and they were primarily places where people who didn't have family or anywhere else to go were taken. Most people, people who had money, so forth, they can have their care taken at home. But for others, individuals, the poor, these were only places available. And so this was the extent of things and how things existed really until the 1900s, and that's where we really start seeing some changes. That is, we start seeing improvement in regards to sanitation, dealing with hospital-acquired infection, and so forth. A lot of these arose due to the result of the Civil War and the work of many public health workers at the time to promote this idea of infection control. One other note is the Marine Hospital Seamen's Act. This was legislation that helped provide hospital care or provide medical care for seamen and others who were involved with trade amongst the United States and with others. Many individuals who were traveling, they couldn't rely on their family for the health care, but the health of these individuals were seen as being so important that uh, the, the federal government sought to provide aid for these individuals. And that act, the Marine Hospital Seamen's Act, really was the start of the public health service in the United States. Nurses really wasn't much of a profession either. Again, the idea of what is a suitable profession, doctors, nurses, again, were not seen as being suitable for anyone. Um, Most of the care that's being provided were being provided by religious orders, mostly by Catholic nuns, which is why in England you still see nurses or still hear nurses being referred to as sisters. That's pretty much what was a callback from that period of time. You start seeing a change, the growing professionalism of nurses starting in the late 1800s. Again, we're talking about the Civil War period. Florence Nightingale and others were working very strongly in trying to improve the care of individuals in hospitals. And they were amongst the people who were involved in trying to promote this idea of sanitation and infection control to help reduce mortality. And again, with health insurance, really wasn't a thing at the time. People either received care or not based upon their ability to pay, or their ability to barter with their healthcare provider at that time. Again, bartering with livestock, with food, services, that's that sort of thing. The idea of a company involving in this process was still quite a number of years off. And for the most part, again, because of the limited science, limited skills of individuals at the time, people were better off not seeking care. They're more or less likely to be as much harmed as helped in the situation. The Marine Hospital Seamen's Act was a very important change, really, in terms of how people receive health care. As I mentioned before, it provided a place for people, specifically merchant seamen, to receive care. Again, the idea being that we have a group of individuals whose work and activity is extremely important. We're providing services by the federal government. This eventually evolved into the Marine Hospital Service. In 1912, it became the U.S. Public Health Service. And much like merchant seamen, other industries uh, develop their own healthcare systems. Again, the idea being is to provide healthcare for those who are working for a particular industry so that they can keep them working and keep them producing. The railroad and mining industries, for example, hired physicians for this activity. Again, primarily to help individuals to keep working in the industries. There was really no coverage for anyone else other than those who were actively involved in the work. Now, Europe was taking a very different viewpoint in regards to providing health insurance or health care for its citizens. Between 1883 and 1913, 8 countries adopted some form of national health insurance or universal health insurance program. Again, providing care for all of its citizens. Ger- the example being Germany. Now, the reasons for this were, in one essence, self-serving, but also to help its citizens. Helping its citizens in regards to those harmed from working in within various industries, the steel, ironworks, etc. Many of those were seeking harm. They need access to care. Prior to this, many individuals received care directly from their trade unions. And this is where the self-serving aspect came in regards to the German health plan. They sought to impose this kind of health insurance program as a way of taking power away from the trade unions, so that people were seeing were to view the government as a way of supporting themselves as opposed to the trade unions. And again, in terms of trying to limit their power in society. They also provide also many types of social programs for the elderly and for other workmen's compensation programs. The idea here being is that they felt a great need to develop programs to promote social stability. Now, there has been an attempt to develop similar kinds of programs in the United States during that time period, where you have a number of other activities going on in regards to worker safety and providing help for individuals. We saw during this time period the rise of child labor laws. We saw the rise of legislation to prevent development of monopolies. We saw legislation regarding focused on worker safety. And at this time, a lot of people tried to develop some form of national health insurance plan. However, a number of individuals, a number of groups were very much against it. One of which being the American Medical Association. They saw it as a form of social insurance and a German plot. And this is also important in terms of 1917. This is also the period of World War One, and anything German were seen with a lot of suspicion. The American Federation of Labor, the AFL, which you may hear about these days as being referred to as AFL-CIO, as one of the largest labor unions in the country, were also not for it. I, Again, the reason being is the person heading the AFL at the time, Samuel Gompers, he wanted the unions to control health insurance plans. Again, they wanted to promote the existence of trade unions uh, to provide care for individuals and to promote the power within the trade unions as opposed to the government, which was happening in Germany. And also at the time, you have the fledgling health insurance companies also working against his proposals. And so as a result, really didn't see much happen as a way of a national health insurance program. This is the kind of language that was used at the time to try to work against the development of a national health insurance program. Would socialized medicine lead to socialization in other phases of life? Lenin thought so. He declared socialized medicine is the keystone to the arch of a socialist state. Again, trying to promote the fear in society against communism and socialism, and seeing the socialized or national healthcare system as being just a step to that program. And this is something that people felt believed in quite a bit, and has led to the lack of support being developed for a national healthcare system. We're going to see this kind of language or this kind of fear come again and again each time we try to talk about any kind of national activity or national policy in regards to dealing with people's health and well-being. Then came the Great Depression in 1929 to 1941. When we talked about windows of opportunity, the windows of opportunity for a national health insurance program closed at this time. There really wasn't much resources for such a thing, and the focus became very different. The focus, people started looking at, how do we feed people? How do we take care of all these individuals without work? This is where we saw the development of an unemployment insurance, trying to support a large numbers of individuals without work. And we also see the development of old age pensions, the Social Security Act, again trying to take care of elderly individuals who again are unable to work at that time. So the difference perspective changed at this point in time in regards to providing a national health insurance program. For the time being, that was taking off the books, and people were focused on other kinds of health policies. Now, World War II created situations that really impacted healthcare and how people access healthcare for many years, really up into our period of time. Now, at this time, many young men, many individuals were drafted or signed up for the military and went to fight in the war. As a result, there was a labor shortage in the United States. And unfortunately, due to legislation, they prevented companies from using wages as a way to recruit individuals. So this is really seen as a way to control inflation. So companies who were wanting to, say, hire individuals, perhaps hire individuals from other corporations, other companies, had to find other ways other than income uh, to entice people to work for them. So what they did was they gave people health insurance, and so this is when employers were became the de facto source of health insurance for individuals. This is where health insurance became the major benefit for employment. This is where you have a tax deductible business expense from health insurance for companies. It wasn't subject to a payroll tax, and it also eliminated organized labor's opposition to employer-based insurance. with people, this was a very popular benefit as a result. And so even non-union businesses and others had to start providing this because companies that did provide it were at an advantage. And so this is really when we start seeing our modern healthcare system. The idea of people primarily uh, accessing the employer in regards for health insurance to provide for their health care, as opposed to this idea that the federal government should be the source or being the provider of health insurance. Also, about this time, post World War II, we have the Hill-Burton Act. What that did was provided funds really for the building of hospitals all across the United States. And so you start seeing hospitals being built and developed all across the country and being identified as a place for individuals to actually access care as opposed to seeking care from family members or someone within the community. So we start seeing the rise of modern medicine and hospitals being the de facto source of healthcare in the United States due to the result of this legislation. Also, part of it led to development of other kinds of healthcare rules. And the discrimination legislation was very much a part of it. You can't deny care for individuals, and also require individuals these hospitals to support Medicare and Medicaid at the time.